Metastatic calcification. Today, I'm going to talk about a topic that often flies under the radar in pathology, but it's important in both clinical and histological settings: metastatic calcification. Let's break it down in a way that's clear and concise. What is metastatic calcification? Metastatic calcification is the abnormal deposition of calcium in normal tissues, typically due to elevated levels of calcium or phosphate in the blood. This condition is distinct from dystrophic calcification, which occurs when calcium deposits in damaged tissues, such as after injury or inflammation. Pathogenesis of metastatic calcification. Metastatic calcification happens when calcium salts deposit in normal tissues due to high levels of calcium or phosphate in the blood. There are several causes behind this, including hyperparathyroidism. Excess parathyroid hormone increases blood calcium. Chronic kidney failure. The kidneys can't regulate calcium and phosphate properly, leading to an imbalance. Hypervitaminosis D. Too much vitamin D increases calcium absorption from the gut. Malignant tumors. Some cancers secrete parathyroid hormone-related protein, which acts like parathyroid hormone and raises calcium levels. Milk alkali syndrome. Overconsumption of calcium and alkali can also elevate calcium levels in the blood. Histology of metastatic calcification. Under the microscope, metastatic calcification presents as calcium deposits within the interstitium of various organs, especially in the vasculature, kidneys, lungs, and gastric mucosa. Compared to dystrophic calcification, these deposits can be more diffuse or patchy. They are made up primarily of hydroxyapatite crystals, and they stain basophilic, meaning dark blue, on H&E stained slides. Common sites of metastatic calcification. Metastatic calcification can affect multiple areas of the body, but the most commonly involved sites are vasculature, kidneys, lungs, gastric mucosa. Is metastatic calcification reversible? Yes. In many cases, it can be reversed, especially when the underlying cause is treated. For example, addressing hypercalcemia, managing kidney failure, adjusting vitamin D intake, or treating malignancy can lead to improvement. Reversal often involves a combination of medication, dietary changes, dialysis, or surgery, depending on the root cause. Is metastatic calcification cancerous? Not inherently. While metastatic calcification can be associated with cancer, the term metastatic here refers to the spread of calcium deposits, not tumor cells. It's more about the systemic imbalance of calcium and phosphate rather than a malignant process. And many non-cancerous conditions, such as chronic kidney disease, can also lead to this kind of calcification. To sum it all up, metastatic calcification is a systemic issue where calcium ends up in places it doesn't belong, usually because of some underlying condition. It's not always dangerous on its own, but it's a clear sign that something deeper is going on, and often, it can be reversed if caught and treated early. Understanding it helps us connect the dots between pathology, lab findings, and patient care. Thank you for listening.